Assalamu alaikum wa rahmatullahi wa barakatuh. Esteemed viewer, wherever you are, nothing I wish for you other than peace. Welcome to your program, Healthy Check, a program where we get free medical advice, a program where we get experts to take you through how, our health affairs. Today in today's program, we are going to look at gum diseases. Still, we are discussing dental system of the human beings. And with me are two gentlemen, two public health dental officers to take us through or giving us advice in this program today. On my immediate right is brother or Dr. Shaban Mugulo, if I'm not mistaken. Yeah, you're most welcome. Next to him is Dr. Chivugu Hamidu. You're most welcome once again.
Thank you. Thank you so much.
In the previous episodes, we discussed about toothaches, still on the dental system of the human being. And today we are going to discuss the gum diseases. I believe our viewer out there knows what the gum is, but you're going to explain to them much more of what the gum diseases are. And on top of that question, you're going to help me explain or tell us what are the prevalences of these gum diseases, please. Dr. Hamid.
Thank you so much. I'm always glad to be here to share with our esteemed viewers. To break it down,
okay.
In our term, gum diseases, we call them periodontal diseases.
Periodontal diseases.
Periodontal diseases. They are called gum diseases.
Tongue twisting.
Now, this term periodontal has two words. One is perio,
okay.
Another one is donto.
Periodontal.
Yes. So perio means around.
Okay.
And donto means tooth. So what kind of diseases we are going to discuss today are those diseases that affect the surrounding structures.
Okay, not the tooth itself,
no,
but the surrounding part of the tooth.
We are not seeing the tooth, but the surrounding diseases of the surrounding. Our viewers should know that basically we have very many issues in the mouth.
Okay.
Cancers, we have trauma, we have various injuries, we have decay, we have periodontal diseases. Okay. So the most leading cause of tooth loss are dental caries or tooth decay. Now the second one is the one we are going to discuss today. So periodontal diseases, as we've said, are the gum disease. You can call them gum diseases.
I think that's the picture we're seeing there on your screen.
Now,
okay.
When we talk of the surrounding structures around the tooth, where the arrow is pointing that is having healthy gum, that is a gum.
Healthy gum
Ideally,
tissue.
that's a gum. Now, below it, that's another structure about among the structures surrounding the tooth, which is the periodontal ligament. And these are just fibers that help to hold a tooth and the bone. Very many people think that a tooth is anchored in gum, which is not true. So the third component below that part is the bone, which is the alveolar bone, because bone has two. They have the alveolar bone, then the compact bone. But that part where the tooth sits is called the alveolar bone. So when we talk of perio around, we are talking of the gum, we talk of the bone, the alveolar bone, and we talk of the periodontal ligament. So those are the structures around the tooth and we are going to see them in their diseased state. Now, in that, if they can give us again that picture, we have seen one side, we are seeing a healthy tooth over structures. Now, other side,
the opposite side.
The opposite side.
Besides the healthy gum tissue, there is the inflamed gum tissue.
Yes, inflamed gum tissue. But we are going to discuss that part. So what I wanted on it, that we are going to see the diseases that can cause your gums to be as that. Okay. So, as I earlier told you, gum diseases in the mouth, they are the second after tooth decay. Okay. So, if at all someone complains of pain, when I don't say tooth that is having a hole, in my mind I expect a tooth that has lost support. Okay. Yes. And this increases with age, because in people above 30, it's about 47%. Okay. Yes. That if at all, in 47% of the population, okay, we can find gum diseases. And when someone, it can increase up to 70% when with increased age, above 65 years. Yeah. So at least everyone has suffered part of. Even in children, we can find it about 50% of children having gum diseases. Yes. I don't know, or it's because we don't mind about oral health. Women, we find ourselves more affected. If at all I have 10 men and 10 ladies, you can find many cases in men as compared to ladies. So, but ladies, naturally, they care about
themselves.
Yes.
Okay. Dr. Shaban, yes. He has defined, actually, we've even got the chance of having a look at the dental system. Well, I would like now to turn to a question of what causes these gum diseases and what are the risk factors.
All right. Thank you. I think we have heard what periodontal diseases are. So now when you look at the causing factors of gum diseases, we have got the major cause, which is plaque. This is the biofilm that forms onto our teeth. Yes. Now what happens whenever food takes long to be cleaned off the teeth, food starts accumulating slowly. Remember, food has got some sticky components, maybe glucose. Yes, that sticky component of food is going to be attracting more and more food debris to make that a plaque. So once you don't remove it, it is going to continue to calcify, like after something like 24 hours. And some people, they come to us, they say, I was eating, but part of my tooth broke. Then you just know, when you examine, you see it is the other calculus that had formed onto the teeth that just broke off. Yeah, so that is basically the most important cause of gum diseases. But we have got others like traumatic, when you injure your gum, maybe when you are eating fish, and maybe fish bone pricks your gum, so it can also cause what? That gum to inflame and cause you pain.
Dr. Chibugu, if you don't mind, do you have any additions
yes.
on?
Yeah, to add on that really how it happens is that now he has talked about plaque that deposits on teeth. Now when plaque is there, these oral microorganisms, they also they become part of it. They colonize it. Okay?
They take charge of it.
Now where does this plaque lie? It's always in between the tooth and the gum. Okay? At that point. Now, they start to produce bacteria, toxins, okay, which start to irritate the gum. Now, the body will react to that irritation when it reacts in form of inflammation.
Okay.
So when the gum gets inflamed, you will see the signs as we are going to see. Now, there are some risk factors. In smokers, okay, if at all you do smoke, it increases your chances to have gum diseases.
Okay.
Now we have hormonal changes in ladies when they are pregnant, the monthly periods. They might come with very sensitive teeth. So hormonal changes can predispose someone, more especially in ladies, to gum infections. Now we have people who are diabetic. Diabetics slows wound healing. Now, if at all this gum is inflamed, if someone has diabetes, they will not heal quickly. So the disease will be worsened.
Okay.
There are several other factors. We have drugs. We have some drugs like the antidepressants. They usually cause a dry mouth. Okay. If at all the mouth is dry, the chances of food logging will increase.
Doctor,
secondly, we have some other drugs like phenytoin, which is used to treat these people who have seizures. They normally cause the gums to swell. Okay, so when the gums swell, that will be a disease. Maybe the last one can be.
Finally, we have a perfect example.
Now, what smoke do you see? There is smoke on that person's teeth.
Exactly.
So when smoke is there in form of tar, the teeth surface will be rough. That means they will facilitate packing of food.
Okay.
So those are some of the causes or other factors that can predispose. Maybe some deficiencies, deficiencies mostly in vitamin C. Vitamin C, the gum can swell. And now others have some diseases, the immune compromised patients, like those ones of HIV, AIDS. We shall see many gum diseases amongst those people.
Well, still on gum diseases, Doctor, I've experienced something that most of the time while brushing, Dr. Shaban,
No.
I see blood, I bleed sometimes. I don't know what brings about that. Is it a gum disease as well, or maybe something else? And sometimes while using my toothpick after eating some meal or any foods that requires cleaning my teeth using the toothpicks, I see my gum bleeding again. What brings about that?
Yes, as Dr. Amidu has already elaborated on some of them, we can see bleeding in people with gum diseases. It is very possible, and it is very, very common. Then also, when you use your toothpick to try to remove the food particle that is in between your teeth, there you are going to injure the gum. You know, in between the teeth, there is a very thin gum that is there, and actually using those toothpicks, we do discourage it.
Oh.
Yes, because you do what you do, you go on to reduce on that the size of that gum. So at the end of that day, food is going to start impacting in between the teeth, because you removed the what? Something that was blocking food to enter there. Okay. So at the end of that day, you are going to go back to
the dentist.
Tooth decay, and again you develop again dental pain.
Dr. Chibugu, in replacement or as a substitute of toothpicks, what do I have to use to remove that remaining food? Because on several occasions my toothbrush has failed to remove that food. How do I remove that food remaining in my teeth besides using a toothpick?
Yeah, thank you so much. One, if at all, if teeth are in a healthy state, it's rare that meat can pack. So one, you might be having maybe a hole that facilitates food to pack.
Okay.
If at all it happens that food packs or meat or any fibrous thing that you eat, unless we advise you to use a dental floss.
Okay.
A dental floss is there.
Okay,
so
okay,
there are
okay.
strings
Excellent.
that are used to clean in between teeth. Okay? So these
I
are
think
tools.
in the next program you'll come with that thing.
All right.
You show us how to use it, because
So,
it's new to me.
So they are strings, you just hold them in between your fingers. So with time you will get used to it. So you just roll one on you, then you
use them.
You use it,
Okay.
to remove. So that one discourages the toothpicks.
Okay.
Yeah, because of
so that's the better substitute for
the
the Asian toothpicks.
Yes.
Our esteemed viewer, you have been given free advice. Replace your ordinary or Asian toothpicks with those new modern, I don't know the name. It's
They're called dental flosses.
Dental flosses. Thanks a lot, Dr. Chibugo Hamid. This brings me to the next question. Yeah. Well, everything before it happens, it gives you a sign.
Yep.
How do I know that very soon I'm going to get a gum disease? What are those signs and symptoms?
Thank you so much. We are going to discuss them in two phases.
Okay.
One, we start with the gum, okay? And those signs there, they are categorized because as these diseases, they are into two. We have the gum inflammation called gingivitis. Okay. The gingiva being inflamed. Then when they progress to the periodontium, the other structures we saw, the ones that actually hold the tooth in its socket, they are called periodontitis. Okay? So in gingivitis, you've eased my work. You told me you have bleeding gums.
Okay.
Okay? That is the cardinal sign for periodontal diseases. If you see it, just now you have gingivitis. Whenever, so that is another sign. Okay? You see a swelling is affecting the supporting structures of the tooth. So gum bleeding is one of them. Two, swollen gums. So go to the dentist and they remove it. Okay. They drain. I told you that is pus.
Oh.
Okay?
Okay.
Why do you want to move around with pus? So
other symptoms,
that's pus. So you have to see dentist as they remove it. Okay. Another thing is that can cause the abscess, that the pulp is dead. It has spread to the surrounding tissues. Now it's swelling. Okay. Yeah. So another sign of gingival inflammation is you can see plaque. We had a picture that had plaque. Okay. Yeah. We can, another cardinal thing, we call it halitosis, a bad breath. Someone talks and you just want to turn away. You
need to put on a mask.
Yeah. COVID had helped us.
Yeah, of course, of course.
So if at all you feel someone with a bad breath that's not present, really, they have that disease, they have to visit. And another thing, maybe what I did tell you, this is a painless disease.
Sure.
Doesn't pain at all. You just stay with your deposits and laugh, but it's progressing. Now, we shall see, if at all you come to the clinic, we can see that in between the gum and the tooth, there is a small biological space. If at all you find that it's deepening, we call them pockets. If at all I find it deepening, I'll just know that there is a disease. Now, there is the first picture they showed. We saw that the bone level had reduced. You can see that on an X-ray. Okay. So when I find, whenever you see the pocket, that means the bone has reduced. So what will follow? Even the gum, if at all the bone reduces.
Yeah, this is our first picture that we had.
Now, if at all the bone reduces, the gum will follow it.
Yeah, we can see this opposite. The opposite bone is a bit lower compared to the...
is following it. The reddening is just inflammation, okay? That we are seeing is swollen, is tender, it's even painful sometimes. So another sign, these people will complain of sensitivities. Generalized sensitivities. They don't have any cavity.
So whenever I take something cold...
Yeah. So that can be one of the causes, okay? That the gum has pulled away, now the root is exposed and the root is entirely dented. So you will have some sensitivities.
Okay.
Now also you have gum recession. I've told you the bone has pulled away, even the gum will follow it. Now you will see as if the tooth is longer than it should be, okay? So that is recession, okay? Initially the gum was long, now it's short.
Oh,
that is as if they are coming out of the bone.
It's as if you're a vampire.
So it's not true that the tooth is just coming out of bone, but it is the gum pulling away. So it is a sign that you are sick. Now another thing, mobility, the teeth will become mobile, because now these are structures that are holding the tooth in the bone.
Exactly.
Whenever they reduce, the tooth will start to get mobile.
Will be shaky.
Yes. For those ones who wear dentures, we shall see dentures are no longer fitting.
Okay.
Yeah. Another, we have only 2 points that we shall see, most especially in old people.
In just 2 minutes.
You see as if the teeth are not aligned. They will go out of line.
Okay.
Someone who had a beautiful smile, it will. Now, the terminal stage. In toothache or dental decay, it goes with half of a tooth. These diseases go with the whole tooth.
Seriously?
Someone comes with a lot of pain that they cannot even touch on their tooth. After numbing, you just hear someone say, has come out.
Okay, thanks a lot, Dr. Chibugu. Dr. Shaban, most of our viewers there didn't know the symptoms till today that we have taught them the symptoms, but they have the disease already. How are they going to get rid of the disease? What is the treatment to these gum diseases?
Okay, the first thing people should do about gum diseases, they have to look out for dentists. You have to go and visit your nearby dental clinic or your clinic of preference. Okay. It's okay. Then also, when you reach there, we can do what we call scaling and polishing. We remove all those hard deposits onto the teeth that are holding those microorganisms that are producing toxins that are irritating our gum to become inflamed. Okay. Yes. Then also we have also to actually you have to visit a dentist regularly, at least two times yearly. Because
I'm lucky I have 2 now, so I think you can do the checkup on one patient at a go. Okay.
Yes, so that is very, very important. It enables us to identify some problems when it is early enough, and we limit their progression, to cause further problems.
Okay.
But only that what another thing that it is very, very important about these gum diseases, he has talked about halitosis. That thing, it looks small, but that bad breath that people emit when you're talking to someone, it is really a problem nowadays. Though some people, you know why it is a big problem? It is very hard to diagnose yourself as you have halitosis. Okay. And even people around you, they fear telling you that your mouth is smelling. So because of that, you are going to be there.
People will just start hating you for nothing.
You see people, when you start to talk, they extend. They don't want to be near you because of the problem. And that mere extending, now you have limited people to talk with. It means you are going to be keeping quiet most of your time.
And through experience, the more you keep quiet, the more it continues.
Exacerbating the problem. So whenever people have halitosis, even if it has started when it is not very, very severe, with the time it is going to just increase, and So for that, just visit a dentist. We can tell whether the cause is of dental origin, and we see if not, still we can see where the cause is and we refer you accordingly.
Dr. Chibugu, you might have one point, just in seconds.
Okay, one small thing. Marriages are broken.
Leave alone people's marriages, Dr. Chibugu. Now let's save marriages.
Yes.
Let's save marriages, esteemed reviewer. I'm going to ask you, Dr. Chibugu, you've mentioned out that point. People are breaking up for something very small. The reason is, to me, you know, we are living in African societies where we are spending a penny for a disease that is out of one's budget in a monthly allowances that they get. It's something very difficult. So this is why I'm going to ask you to save marriages of our viewers by giving them some measures they can take to prevent these diseases before they reach the climax, or even before they get to their gums.
The earlier the better.
Okay, so what are the preventions?
The earlier the better.
Okay.
The first thing, put it, let's drop this African mentality.
Okay.
That I only go to, I'm healthy so long as I don't have pain. Okay? Let's do at least.
I only visit a doctor when I feel some pain.
When I have an issue. No. Make it a point that me and my family will do twice visits per year. That is every after 6 months. Every after 6 months. If at all you come to me and you are not brushing well, I'll tell you, this gum has started to get infected. I'm seeing plague. He told us that plague initially it's food, which you can easily rinse off. After that, the food sticks on the teeth. There you cannot rinse it off, but you can only brush it off. Okay. If you fail, in 72 hours, it starts to get hardened. There, you cannot remove it unless you bring it to me. So, initially, you can just rinse it off. You don't even need toothpaste. Now, if at all it has stuck on your teeth, then get a brush. Brush well. So, tooth brushing. Okay?
Thoroughly brush your tooth.
Brushing.
Our esteemed viewer.
So after brushing, if at all you don't, please come to the dentist. We clean your teeth when it's still early. When you come, when the bone has. But this is the other thing, that periodontal or gum diseases are irreversible. Many of the dental, by the even cavities, they are irreversible. So once the gum reduces, it is gone.
Visit the dentist
like
before.
That person they showed us with gum recession. Even if we clean, the smile will remain so.
Thanks a lot, Doctor. Thanks a lot. Time is never our friend. Like I told you in our previous episodes, we've never been good allies with time. But what I've learned from you today is visiting the dental clinics or dental advisors regularly. I'm lucky I have both of you. I have two, and you have advised us that we should at least visit our dental advisors at least twice a year. And I'm lucky I have two, so you can take summer exercises.
6 months.
You have to wait for 6 months.
No, you can come after 6 months. You go to him.
I thought since you are two, I have two of you. You're going to do the medical checkup. I mean the dental checkup at once, and that's good to go. Okay, our viewers, it's really paining. It's hard believing that I have to put to a close this program, but still more inspiring programs are still coming. So please stay tuned in. MTA, in case you have any comments or some remarks, you can send us a message on our email, which is africa@mta.tv, or visit our website, which is mta.tv. We're going to watch more inspiring programs like this. I remain your host, Nambale Bashir. Until we meet next time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.